Good evening, I'm Ryan Benazzo.
And I'm Catalina Gillies. The family of a Thunder Bay man who passed away suddenly in September is expressing outrage with Ontario MPP Randy Hillier.
The Kingston area politician is facing widespread criticism for sharing photos of their loved one and others in a social media post, falsely claiming that all of their deaths were caused by the COVID-19 vaccine. Hillier posted a photo of 39-year-old Brian Dijak along with 10 others in a Facebook post accompanied by short descriptions of their deaths. A number of families have spoken out regarding their disapproval of the post. A close friend of the Dijak family, Ryan Lavia, shares their reaction.
After the family became aware of the post, they had reached out and I'd spoken to them, and they, like so many others, are shocked and sickened by the actions taken by this individual. They've completely denied the allegations. There's no truth to it. It is completely fake news.
Hillier, who was expelled from the PC party in 2019, released a statement responding to the negative feedback. He's now calling on OPP Commissioner Thomas Carrique and local law enforcement to begin criminal investigations into these deaths to determine whether or not a pharmaceutical product was a contributing factor.
The district's medical officer of health is reminding locals that loosening restrictions at events does not mean other safety measures have changed. Dr. Janet DeMille is also listening intently to the province's chief medical officer of health, who has hinted at moving to a more regional-based plan to manage COVID-19. Corey Nordstrom has the details.
Capacity changes for some venues may seem like things are getting back to normal, but the district's medical officer of health wants residents to remain cautious. They have received calls from organizers and the public about individuals not wearing masks or violating other pandemic rules, but none so serious that she had to get involved.
We are not seeing spread at those events at this time, but our COVID rates are really, really low at the present time. And I think, it's going to be watched very carefully at the provincial level in terms of whether there is spread and how significant that spread is at these events.
The Ontario government is poised to announce further details on Friday for its long-term strategy to reopen. Chief Medical Officer of Health, Kieran Moore, has stated his desire for more regional restrictions rather than province-wide.
We've struggled with that here before because we've had low case rates when some places, especially down in southern Ontario, haven't, and then we've been perhaps had more stricter public health restrictions imposed here because of a provincial approach. And I certainly am supportive of looking at regional options.
DeMille is also feeling hopeful after the federal government secured 2.9 million doses of the Pfizer vaccine, specifically for children aged 5 to 11. Health Canada has yet to approve the batch made specifically for that age group, but the health unit is preparing to start immunizations towards the end of November or early December if that approval comes. DeMille has also heard of some other good news on that vaccine front.
Probably won't be experiencing supply issues around the pediatric formulation, that like the same way we saw earlier this year with the adult formulation. It was a little bit slow in coming. It does appear that that won't be the case.
Corey Nordstrom, TBT News.
The regional hospital continues to chip away at surgical wait times that ballooned at the height of the pandemic when non-emergency surgeries were delayed to ensure there was enough capacity to treat COVID-19 patients. But people in the Northwest are still waiting more than 2 weeks longer to go under the knife than they were pre-pandemic. That's according to Hospital Executive Vice President and Chief Nursing Executive Adam Vinette. The provincial target for non-emergency surgical wait times is 182 days. Even before the pandemic, the average wait time at the regional was higher at 195 days. Now, surgical patients are waiting an average of 211 days, but that has decreased by more than 3 weeks from the height of the pandemic, when patients typically had to wait 234 days for surgery.
To bring the wait times down, we've actually had to increase operating room days. So what's worked was extending the workday and getting the volunteers and the nurses and the physicians to really stay a few hours every day just so we can slowly chip away at that while preserving the capacity in the system in case there was a need for emergency surgeries and staff being called back into the operating.
Bennett says he's very cognizant of burnout among surgical staff, and those measures were implemented with their input. He adds the hospital will continue to explore ways to further reduce the surgery backlog and hopefully meet the provincial target for wait times. Overall hospital capacity now sits at 86%.
The Ford government has announced details of legislation designed to make it easier for new Canadians to get licensed to work in the province. It comes after the Premier came under fire this week for comments he made about immigrants. Sean Leathong has more.
With a major labor shortage in Ontario, the provincial government says they're trying to make it easier on new Canadians to get work in their chosen field.
They often face endless government bureaucracy and red tape when seeking to get their start.
According to the Minister of Labour, Training and Skills Development, Monty McNaughton, in Ontario, new Canadians are facing significant red tape in finding work when they come to Ontario.
Only 25% of these newcomers are working in a job that matches their skills, despite almost 300,000 jobs in Ontario going unfilled and billions lost in productivity.
And so McNaughton is proposing a bill that he says will reduce requirements for Canadian work experience for professional registration and licensing, will eliminate duplication of official language testing, and allow for faster registration in emergencies. Also, it will speed up the licensing process for internationally trained immigrants.
If we're going to tackle the generational labor shortage facing Ontario, we need everyone participating.
Sean Leathong, CTV News, Toronto.
The City of Thunder Bay is once again getting revenue payments from the local Gateway Casino. OLG announced today the city received $610,000 for the period of July to September. That amount is very close to pre-pandemic levels, even though the casino was closed until mid-July and also dealt with strict capacity limits. The city receives 5.25% of all slot machine revenues, including automated games like blackjack and roulette wheel, which are currently offered only on machines. Casino and OLG officials attribute the high revenues to pent-up demand following many months of closure.
Music sounds good online, but there's nothing like the sound of a symphony orchestra in person. And tonight, the TBSO marks its return to live performances. The first show of the season, titled Having a Lark, will take place at the Hillier Lutheran Church tonight and tomorrow at 7:30. It's the first of many concerts planned from now until the end of April. Music director Paul Howe says they have high expectations for the success of the show.
I'm expecting some serious excitement in the room. This has been so long coming. We're all so excited to get out there and perform, give it our all, and honestly, have a live audience in the room. It's incredible.
The TBSO concerts usually take place at the Community Auditorium, which won't reopen until December. So for at least the next few months, the concerts will be held either at Hillier, the Da Vinci Center, or the Italian Cultural Center. The capacity for this first show is set at 125 people, but Haas says they are planning to revisit their seating limits for future concerts.
Magnus Theatre is debuting its second production of the season tonight. Titled Lunenburg, the romantic comedy stars a number of local actors. And despite recent government changes, Magnus has decided to remain at 50% capacity. Danielle Bain has more.
Magnus Theatre's Lunenburg takes viewers on a journey to a different shore. Set in Nova Scotia, main character Iris inherits a property in the seaside village after the death of her husband.
Charlie knew Robert. Oh, but he went by Bobby up here.
Bobby?
He didn't mention he had a wife either.
The story starts out really with her world being sort of turned topsy-turvy, and her friend are traveling to Lunenburg to look at the house. But for Iris, it's also just it's a difficult time.
Artistic director Tom Curry says the audience will relate to the attitudes portrayed by Lunenburg's characters, with laughs abundant throughout.
Oh, a handyman.
That's right. I'm not the best, but at least I'm handy.
A light,
romantic comedy. There's a little bit of a mystery involved in the show itself, but it's a classic kind of Norm Foster romantic comedy. Two characters, around 50 years old, having been around the block a couple of times, getting together.
The show will be at 50% capacity despite the province allowing for full theaters. Viewers will also be distanced between each party. Proof of vaccination and masks will be required. Curry says the decision was made while thinking of those who attended the last show, wanting to ensure their safety and enjoyment of the production.
People can have that comfort level so that people can go, all right, you know what, I'm not shoulder to shoulder with other people in this auditorium, and that they can just relax, let their hair down, and enjoy the show. And to me, that's everything in the theater, that you can sit there and relax and forget the outside world for 2 hours.
The sense of community that comes with theater is amplified by the fact that Lunenburg stars a number of local actors, including Albanese.
But it's something a little bit different when all of the artists and creators, most of them are from Thunder Bay or have a tie to Thunder Bay in some way.
Lunenburg runs until November 6th with matinees on Wednesdays, Saturdays, and Sundays. For tickets, call the Magnus box office. Danielle Bain, TBT News.
C.D. Howe Public School is partnering with Eco Superior, the district health unit, and community spokes to teach safe bike etiquette on a morning ride. And the school also has brand new bike racks for the kids. Mitchell Ringos has the details.
Over 25 students at C.D. Howe Public School took to the streets and pathways during the early morning, heading along McVickers Creek, where they learned how to properly cross an intersection, use proper hand signals, and stay safe on the road. The students and staff traveled just over a kilometer in distance over the hour. An active transportation transport coordinator for Eco Superior, Kelsey Agnew, says the goal is to promote active school travel and bike safety in a fun and inclusive way.
Coming to school actively, either by walking, scooting, biking, and that has so many benefits for the children's physical and mental health, environmental health. Learning everything, starting your day off actively is what we're trying to promote, and then also ending the day that way. That little bit of extra activity can make a big difference.
Once the students got back to the school after their group ride, they got to pick out some prizes and got a free bike tune-up by the on-site mechanics. Even with the cold fall weather, the students seemed ecstatic to go on a ride through the streets with their friends, especially during school hours.
It was really fun. Because that was the first time I did it, ever in my life, so.
It was really fun, and I thought it was really beautiful. I liked the feeling of being outside.
It's important for kids to get exercise and have a day of just fun, just to get out of school and to make memories.
And with this being the first successful bike day here at C.D. Howe, there is more to come, as this will now be an annual event. Mitchell Ringos, TBT News!
Well,